Hi, my name is Judie VanKooiman, and you're watching March edition of Life Issues. This month's topic is Senior Benefits Boston, and my guest is Scott Maibor. Welcome, Scott.
Thank you very much.
You're welcome. Scott, how long have you been with Senior Benefits Boston?
Senior Benefits Boston, about 5 years. So it was a spin-off of another company, Voluntary Benefits of New England, which is about 12 years old. A friend asked me to help him with some Medicare cases, and that kind of blossomed into its own business.
Okay. And what is your title?
Officially for the company, managing director, but insurance advisor or insurance broker, depending on which license you want me to use.
Okay. And what are your 5 objectives?
So my 5 objectives when working with a client is really education, because I find it much easier to help somebody if they and I are on the same page, so they understand what I'm talking about, rather than me kind of just dictating, this is the best thing for you. I analyze their situation. We recommend a solution throughout the year. Once the solution is in place, it's support. It's really, I had a problem at the pharmacy, I had a problem at a provider's office, and then very important and overlooked a lot of times by Medicare recipients is review. That every fall during open enrollment, you have to review.
Okay. And what is your mantra?
Educate, 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 and review. Review, review. Those 2 things, if you do that, I think you'll be in great shape.
Okay. And what are the areas of exposure is where you can help? Really,
it's a matter of looking at somebody's situation, and everybody's situation is a little different. Their eligibility, what are they eligible for? And to some degree, Mass Health or Medicaid comes into play with that too. Timing is a big part of it because there are penalties if you do it late. But if you don't have to have Medicare because you have coverage from an employer, you may be able to delay the time where you get onto Medicare. In some cases, it's a coverage comparison between Medicare options and or a plan from your employer or your spouse's employer. Cost is a big one, as well as premium, and those 2 things are different. So cost, is kind of the whole picture, and a lot of people look at simply the premium, which weighs into the cost.
Okay. And what is open enrollment for health insurance?
So it's open enrollment, so the Medicare annual enrollment period, which most people refer to as open enrollment, is October 15th to December 7th. So every year, October 1st, we can legally talk about the next year's plans. You can't sign anybody up till October 15th. But October 15th is when people can actually decide I should switch plans for the following year, or I'm going to stay with what I have. This year in particular, there were a lot of changes. Harvard Pilgrim pulled out of the state. Some of the drug plans left the state, as well as 7 new carriers came into the state. So there's a lot of things happening, not to mention people's prescriptions change, people's health changes. So there's a lot of reasons why you should take advantage of the open enrollment, just to make sure that you are in the best plan, because surprisingly, and it was actually a surprise to me too, that if your drug plan, let's say, goes away, they move you to the most expensive drug plan. That's federal law. So whether you need the most expensive drug plan or not is irrelevant, but all of a sudden you went from a $20 drug plan to a $75 drug plan or a $100 drug plan, depending on the carrier. Because that's the law, they have to move you to the most expensive one. Maybe another carrier's $20 drug plan is perfect for you. In the case of Harvard Pilgrim, everybody got moved to Tufts. Not that it's a bad plan, but your doctor may not be in the Tufts network. And a lot of people are very surprised to find that out when they went to make a doctor's appointment in January and discovered their doctor is not in the network of their plan anymore that they got moved to.
Is there anything that they can do about it?
Yes, because there is another open enrollment period, which is actually the Advantage Plan open enrollment period, which goes from January 1st to March 31st. So if you have an Advantage plan, you do have that extra window of time, the entire first quarter. The people who are really stuck, unfortunately, are the traditional Medicare with a drug plan that once open enrollment closes December 7th, in theory, you're stuck for the year. And most people don't realize that they're in the wrong plan until January 1st when the plan starts. They go to the pharmacy that first week of January and they discover they have a huge bill. One of their prescriptions were dropped from the formulary. Their new drug that they forgot to check isn't in the formulary. And now it's too late. And in theory, you're waiting until January 1st of the following year to change plans.
Wow.
And I've had that happen a bunch of times this year.
Oh, I would not be happy about that.
No, it's really unfortunate. There are ways around it. I don't know if you want me to go into some of the stories, but I had somebody who very innocently left off 2 prescriptions to the list they provided me. So we chose a plan based on the 5 drugs they gave me, but then they went to fill number 6 and 7, and it was a surprise. And that's unfortunately Medicare's attitude was sorry. So that there was some workarounds that we were able to do, but forgetting a couple drugs is really a problem. Yeah. I also have somebody who he called me about his wife's prescriptions. They've gone way up in price, and he and I never connected. We played a little phone tag. I never got the drug list that I asked for. And he asked me what he could do. Her drugs actually are now estimated to be about $5,400 this year out of pocket. Wow. What I did tell him is, now she has a supplement with a drug plan. I said, if we move her to an Advantage plan, even if it's a temporary fix, the drugs on that plan would be $1,400 out of pocket. So it's a substantial savings. Plus she would save all the premiums. Plus it would give her the dental and the vision, which she's now paying extra for. And then I said, try that plan, and if it doesn't work, we can move her back during the trial period. So she was very adamant against no Advantage plans, and she's been a client for several years. But now I think it makes sense to try it, even if it's a short-term fix, and we change it back maybe next year, maybe before then. But there's ways around some of the rules, or ways to work within the rules, I guess. But you have to know the rules, and people get stuck, and it's too bad, because it's really a shame when you get that call and it's just too late to do anything.
Mm-hmm. Oh. And can anyone apply for Medicare and open enrollment?
Medicare is available to anybody over 65 or disabled for more than 2 years. If you are applying during open enrollment, so there's your initial enrollment period, which is when you're turning 65, 3 months before, that month, 3 months after, that's your initial enrollment period, or IEP. That's when you want to enroll if you're going to go on Medicare. If you miss that period, unless you have a special enrollment period, now you're stuck with the GEP, which is the general enrollment period, which is the first quarter of the year. But that one doesn't have an effective date for whatever reason. I've never been able to find out why, July 1st. So if you happen to miss your enrollment period and now you're signing up in the 4th month after your birthday, you're not effective until July 1st. And they make people wait. And I've had people with cancer through no fault of his own. It was in his case, he's 85 years old, applying for Medicare for the first time. He was covered under his wife's employer's plan. The employer has been bought and sold a bunch of times. We can track, so he's got 20 years of coverage he has to prove he had. We were missing 2 years. That the records for those 2 years just don't seem to exist anywhere. So they penalized him for those 2 years, not only financially, but said, you are not eligible to enroll in a plan because you missed those 2 years. You have to wait till July 1st. He's 85 years old with cancer.
My gosh.
The stories, and that one ended up, he was pretty diligent about that. He actually brought it to his state rep, who actually was able to work the system and get this corrected, but it's so unfair. There's absolutely no reason why he had to wait till July. Yeah. Every other enrollment period takes place the month following. Yeah. You have to wait till July, and this was literally September. So that was a long wait for somebody on cancer treatments to not
exactly.
have any insurance.
And being 85. Oh,
Yeah.
God.
So,
But glad that he got it worked out.
Yeah.
So regarding Medicare, what's covered and what is not covered, and what are the costs, and what role does income play?
okay, that's a lot of questions. So Part A typically has no cost if you've worked for 10 years in the country. So no premium, but that's the free one, quote unquote. The problem is it's not free because if you use the plan, you go into the hospital, it's almost a $1,600 coinsurance. If you stay in the hospital for more than 60 days, there's a per diem of $325 a day. If you go to rehab, the first 20 days are free, but then it's $186 a night until night 100, and then you're done. You have no coverage. That's the free one. Part B, the standard rate right now is $170.10. They're talking about maybe reducing it, but it's probably unlikely that it will get reduced. That is income adjusted. So when you mention, how does income play a part? If you're considered a high income earner, and it depends on whether you file individual or jointly, there is a sliding scale, and you'll hear it referred to as IRMA, the Income-Related Medicare Annual Adjustment. It lags by 2 years. So the 2022 premium is going to be based or impacted by your 2020 taxes. And they use the modified adjusted gross income, which means they're not just your AGI, but your modified adjusted gross, which means they're putting back some things that you would never think to put in, like income from municipal bonds and other tax-free investments. So that sliding scale goes in increments up to a maximum of almost $750 a month per person. So if you're a couple and you make a lot of money, you're also going to pay a lot for the insurance. Part B is 80% coverage, 20% coinsurance. So whatever the bill is, you pay 20%. There is no cap. So unlike most health insurance plans people are familiar with, there's an annual cap. This has no cap. So for a doctor's office visit, could be $20, $40. For a surgery, could be thousands with literally no cap. There's a $233 annual deductible that you have to pay now unless you're grandfathered in. And that's Medicare from the federal government. Everything else is private insurance. And the private insurance breaks down to the supplements and the drug plans, which are the fixed cost plans. And the drug plan also is impacted by income. So the way that would work is if you have a $20 per month drug plan, and they range in price from $7 a month to $130. Average price is about $18, $20 in that range. If you're surcharged, whatever drug plan you pick, whether it's $20 a month or $50 a month, they add the surcharge to it. So the income is on that as well. Or you go with an Advantage plan. So that's the supplement in Massachusetts. We have a simplified system. There's Plan 1A and the core plan. And for a round number, I usually tell people Plan 1A, which would be my recommended one, is $175 a month. And a drug plan, $20-25. So I usually use a round number of $200. Many people will be below that, but I'd rather give good news than bad news. Or you go with an Advantage plan, which has typically no premium. And I see a lot of people who are paying a premium on them. So if you have somebody watching who's got an old Advantage plan, I spoke to somebody the other day, she's paying $175 a month for her Advantage plan. It's no better than the $0 Advantage plan. It's just she's on an old plan and she thought it was a supplement because she's paying for it. Now she's got co-pays because she's seeing a physical therapist and she's paying for it, as opposed to if she had the supplement for the same amount of money, she'd have no co-pays. So, and she honestly thought she bought a supplement and for 3 years has had this plan and just assumed it was always a supplement, but never used it enough to really notice the difference. And interestingly enough, she called the carrier, who confirmed that it's not a supplement, and she asked about changing, and they said, no, you can't. And I said, that's absolutely incorrect. You're during your open enrollment period. You can change until the end of March. And she said, no, they told me I can't. I said, they're wrong. I said, I don't know why they told you that, but it's incorrect.
So is she going to change?
Yeah, I'm talking to her tomorrow.
Good.
So
Good.
she wanted to confirm that I was right, but
Yeah.
I said, no, we can sign you up for your, and she didn't, the only reason she discovered this, she interestingly enough spoke to a client of mine who just signed up for a supplement last month, And she was telling her, like, oh, I have a supplement too. She's like, but I have copays. And she's like, no, you don't have copays on a supplement. And and it is different in Massachusetts, but in Massachusetts, you're typically not going to have any copays on a supplement. And when she found that out, and she's paying $40 a visit to the physical therapist, she's like, oh, then maybe I don't have a supplement, and that's what kind of started this.
Oh,
So
that's good. Good. Okay. And how old do you have to be on Medicare?
typically 65. If somebody's determined to be disabled and on SSDI, Social Security Disability, after 2 years, they'll automatically be placed on Medicare.
Okay. And what is your Medicare 101 system?
It's really a run through. I mean, I do it a lot. I was doing it at the start of COVID, just randomly doing it on Facebook Live and Zoom. Happy to do it anytime somebody wants to hear it, but it's really just a run through. You know, much of what we just spoke about with some visuals, you know, what's A, what's B, and then I break it down into option 1 and option 2 with a supplement and a drug plan or the Advantage plan, and they're mutually exclusive. So, and there's pros and cons to both. A lot of people, you'll hear a lot of bad press on the Advantage plans. Some of it's deserved, some of it isn't. But in some cases, I think it's a great fit. In other cases, I think it's a terrible fit. It really depends on the situation. And I'm unbiased, so it doesn't matter to me which one you think is better. And I'm also kind of a math guy, so to me it's a math problem, you know, where's the break even? But I'm not the one on the plan. So ultimately you have to be comfortable with the plan you select, and it does go to more than math. I have a woman up in Peabody who, she wanted something less expensive. She couldn't afford her supplement. She has a dental plan, which is horrendously expensive, and she wanted to just do away with all that. She had one copay in a year, and it freaked her out so much that even though she saved about $2,000, she had one $150 copay for an MRI and said, I can't have this. I can't sleep at night. It's driving me crazy. And I said, but you're still $1,800 ahead of the game. Can't sleep at night. So, I mean, it's more than math. It's emotion and, you know, philosophy, and a lot goes into these decisions. And, so we put her back on what she wanted.
Okay. And what is the Medicare Advantage open enrollment period? I know we talked about it a little bit, and that's different from open enrollment period.
Right. So open enrollment is for anybody to do anything. And in Massachusetts, because there's no underwriting, it's truly an open enrollment period. That's different in other states. The Medicare Advantage open enrollment period is the January 1st to March 31st. So that's anybody who has an Advantage plan can switch to what they call traditional Medicare with a supplement, or they can just choose a different Advantage plan. There's also kind of a good time to mention it. Tufts is the only carrier in the state that has 5 stars. Because of the 5-star rating, they are able to not have an open enrollment. You can sign up for a Tufts Advantage plan whenever you'd like.
Okay. And what are the parts of Medicare again?
Part A and B. So A is hospital, Part B is medical, Part D is the drug plan, Part C is an Advantage plan, and supplements don't have a letter, they're just supplements. Or some people know them as Medigap plans.
Okay. And can you share some of the stories you have heard from clients?
Yeah, I mean, in terms of how the plans work, or in terms of,
Yeah, just.
I think for a lot of the people I speak to, they are interested in, they've spoken to a sibling, a neighbor, a brother-in-law, and they've gotten some advice. A lot of people that I speak to come to me and say that they do not want an Advantage plan. And you start talking about the pros and cons of each, especially in a state like Massachusetts where you can freely change without any underwriting. The Advantage plans have some appeal. In other states, it's a more weighty decision because you're kind of stuck in the plan if something goes awry with your health. But, I really like talking to people. That woman I mentioned whose husband reached out to me, and, they're just kind of stuck. Like, wow, we can't afford these medications. Is there a solution? Yes, we can, and we can work a solution that will save you thousands of dollars this month or this year. And even worst case scenario, if everything goes wrong and you max out your Advantage plan, you're still $1,000 ahead of the game. So that's worst case. And people tend to focus on the Advantage plan max out of pocket. And it's funny because people who are working still never know what their max out of pocket is on their current plan. But because I always mention it, like, oh, that's a lot of money. I've probably had 3 people max out the plan in all the years I've been doing this. I have one of the gentlemen had an aneurysm in August, which led to a stroke and infections and horrible situation. And he had an Advantage plan, which they were very happy with, but now he's in Mass General intensive care. He needs to go to a rehab, but a very specialized rehab because he has a tracheotomy. He is paralyzed. He can't speak. The Advantage plan is no longer the right plan for them, quite frankly, mostly because they live in Salem and Advantage plans have networks, and Spalding, which takes his plan, but the special division of Spalding that takes the trach patients is not in the plan. And the problem wasn't that the carrier turned down Spalding. Spalding turned down the carrier because I got the call that, the carrier's not allowing it. It wasn't the carrier, it was the hospital. So his wife called me and said, what can we do for him? And he happens to actually be a friend of mine. I said, we need to put him on a supplement. And she said, that's not, he's in intensive care. We'll have to wait till he's released. And we were able to put him on a supplement, which allowed him to go to Spalding, which was great because she lived in Salem. They were going to put him in Dedham. She's like, how am I going to get to Dedham every day? Wow. And not to mention all the out-of-pocket expenses. In his case, spend 3 months in the ICU, you'll max out your plan. But it's hard to max out the plan, and there's always a way, like people are like, how could you switch plans while somebody's in the ICU? Massachusetts has no underwriting. You can simply switch plans. So it's, as a matter of fact, I'm trying to think how I should say this. There is a practice, which I'm not necessarily a fan of, so I don't recommend it, primarily because of what I went through with my friend, but people will buy the cheaper of the supplements in Massachusetts. If you're hospitalized, they'll tell you that then when you're in the hospital, you should switch from the cheap supplement, which is called the core plan, to the better supplement, which is plan 1 or 1A. The problem with that I see, so yes, you'd pay the core plan doesn't cover the inpatient hospital, so it's $1,600. But then you should switch, because if you end up in a rehab, you want to get that covered. The problem is, and I saw this with my friend's wife, who's, very with it, working, tech savvy. When your spouse or a loved one is in the ICU on a trach, can't move, you are not thinking of what's the best insurance plan and, I got to call my agent or the carrier and make a change. I think that's a really difficult position to put the family or the individual, assuming the individual is able to do it, in. And I think that there's a place for the core plan if budget's tight, but it's really unrealistic if somebody's hospitalized to expect them to remember to call their insurance agent or call the carrier and switch plans.
Okay. Scott, if anyone has any questions, can you please give us your contact info?
Sure. Let's see, phone number is 617-721-1250. My email address is Scott, S-C-O-T-T, at S as in Sam, B as in boy, Boston, so SBBOSTON.org. Website is sbboston.org. I'm on Facebook, I'm on LinkedIn.
All right, great. I'm sorry, but that's all the time that we have. Thank you, Scott, for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.